than I'm used to speaking. I'm up usually at like 4:30, but this is a little earlier than I'm used to actually talking to people. Thanks for having me. As Cindy said, my name's Amanda Missey. I'm the Executive Director of Bergen Volunteer Medical Initiative, which is, we're located in Hackensack. We are a healthcare center, and we provide free primary health care to the working poor in Bergen County. So our patients have to be working, they have to live in Bergen County, and they have to earn, but somebody in the household has to be working and earning between 100 and 300% of the federal poverty level. Do you know, anybody want to take a guess as to what 100% of federal poverty level is for an individual?
15,000.
30, 25, 15, 18. Well, you're kind of close. Whoever said 15 is kind of close. You almost won. It's closer to about 12,000. So imagine trying to live on $12,000 a year in Bergen County and eat and buy clothes for your whatever and still get health care. So those are the people that we take care of. Actually, BVMI kind of has its roots in Wyckoff. Anybody here know Dr. Sam Cassell? Have you ever heard of him? Yeah? Yeah. Huh?
I played tennis with him.
You played tennis with him? Okay.
Wow.
You still do? Okay, used to. All right, well now he plays bridge. I'm not sure if he plays tennis anymore. About 10 years ago, Sam was, he is still a physician, but he was practicing, and he retired. He did some volunteering. He went on a trip to Vietnam or something, helped a girl get cleft palate surgery and thought, wow, that was kind of cool. I like doing that. Came back here, was going to go on a medical mission to Haiti, hurt his back so he couldn't travel, but he still wanted to do something. And he met another doctor, another retired doctor, Jack McConnell, who had retired to Hilton Head, South Carolina, played golf every day with his other retired doctor buddies, got a little bored and saw that there were a lot of people, you know, Hilton Head is really built on tourism, saw that there were a lot of folks who were working to clean the rooms in the hotel and serve the food and, you know, do the landscaping and all of that, and that they didn't have health care. And he thought, wow, I've got all my retired physician friends here. I'm bored out of my mind playing golf every day, and these people need health care. So what can I do about that? And he created Volunteers in Medicine, which is now we've got 97 Volunteers in Medicine clinics all over the country, but they're all basically founded on the premise that we use volunteer clinical professionals, so doctors, nurses, nurse practitioners, nutritionists, nutritionists/dietitians, social workers. They volunteer their time to come in and care for people who are working but very low income and don't have health care. So we opened our doors almost 6 years ago. We are located in Hackensack. We don't call ourselves a clinic, we call ourselves a healthcare center. So I just started there about a year and a half ago, and when I started there, they kept talking about the culture of caring, and I'm like, yeah, that's so sappy, culture of caring. Well, you know what? It's real. We are it's a mini United Nations there. People speak, there's probably 30 or 35 languages that are spoken amongst our patients. So we have interpreters. We make sure that people understand their healthcare situation in the language that they are most comfortable speaking. We have written materials in different languages. The cool thing for our doctors is that they spend like a half hour to an hour with our patients. How many of you have been to the doctor in the last couple months? Anybody been to the doctor? Okay, so how long did you spend with your doctor?
About an hour.
An hour?
Yeah.
Wow. Did you like?
We should play golf.
Told somebody.
Good one, Jim. Good one. Right.
To an office to see a doctor. How long did you spend with the doctor?
Good one.
Maybe 4 minutes a week.
4 minutes. Okay. All right. Anybody else?
5 minutes.
5 minutes. Okay. Do I hear 10? No. No? Okay. More? Les? Yeah, so when we schedule our patients, we actually schedule a half hour for people who've been to see us before and an hour for a new patient.
Wow.
So the doctors love it because they get to practice medicine like they want to practice medicine. Yeah. We don't have insurance. There's no money. It's all about the patients. So the patients that we have, they're low income and they generally have kind of low health literacy. So there are a lot of misconceptions. They don't know necessarily that they need to take care of themselves on an ongoing basis. They might not understand a diagnosis. So we have a nurse navigator in our office, and she speaks 6 languages.
Wow.
I know, she's amazing. But her whole job is to do the hand holding. So somebody sees the doctor, say they've got diabetes. So Vicki will sit down with that patient, really, talk to them, help them understand what's going on with them. She makes sure that they go to whatever appointments they're supposed to go to. So she's really hand-holding all the way through. We also have a certified diabetes educator. So her whole job is to work with our diabetic patients and people who are pre-diabetes and moving towards diabetes, to make sure that they can get their disease under control and manage it. Because even for people who have higher health literacy, managing a chronic condition is really hard. So we do lots and lots of hand-holding to make sure that people are going to be successful in taking care of themselves. We've got so we have 1,000 patients. 65% of them are women. And most of them are heads of households who are earning the money in the household and supporting the family. So if they get sick, the kids don't eat, they don't pay the rent, you imagine how that would spiral out of control. So for our women patients, we have a women's health initiative. So they will see their primary care physician, and then every single woman patient gets referred to a women's health practitioner. We have 3 gynecologists and 2 advanced practice nurses that see women in our women's health initiative. If you're 40 or over and if you're a woman and 40 or over and haven't had a mammogram in the past year, we refer you out to a mammogram. So we have relationships with all 5 hospitals because that's where we send people to do diagnostics like mammograms, screening colonoscopies, x-rays. What we work really hard to do is to make sure that when we refer patients out that they don't have to pay there either, because that's going to actually keep them from getting anything done. The healthcare reforms had a little bit of an effect it's had a big effect on us, but one of the things that's happened is we used to be able to just send our patients to a hospital and they'd go through a charity care process, but if they weren't qualified for 100% charity care, they still got the procedure. With healthcare reform, a lot of the money that used to go for charity care to pay for people who didn't have money has now gone into Medicaid. So there's this constant shift of what's going on. So one of our biggest challenges is getting hospitals to do the procedure for free. We've got specialists outside of BVMI, so if we have somebody who has a heart condition, we can refer them to a cardiologist who agrees to take our patients for free. So it's a whole system that we've got set up. We have really good results. Our diabetes numbers are excellent. We do a good job. We can't do it without supporters. We don't get any insurance. We don't take insurance because our patients are uninsured, duh. We don't take any payment from patients, although we do have this clear box on the way out of the healthcare center, and they'll come by and they'll put, sometimes it's a quarter and sometimes it's a $20 bill because they value what we're doing for them and they feel grateful that we're able to do it, so they give us what they can. We also don't get any government funding, so it's all fundraising. That's my job. That's why I have bags under my eyes. So one of the things we do to raise money, we have one single fundraising event a year. It's our anniversary gala. We happen to have it coming up on Sunday, which is really why I've got bags under my eyes. We're doing it at the shops at Riverside. We thought we'd try something a little different than going to Seasons this year. So It's going to be really fun. I've got information if anybody wants it. Anybody know Ken Herman? Do you know him? Nobody goes to Wyckoff Y, I guess.
Yeah.
Yes, okay. Apparently he accosts everyone he knows or sees at the Wyckoff Y to tell them about BVMI, and we're actually honoring him at the gala on Sunday because he's done such a good job for us. All right, enough talking. What questions can I answer? Oh, come on.
What is your annual budget?
Our annual budget is $940,000. We also get an additional $450,000 in contributed services from our clinical professionals and our other volunteers, but a pretty significant contribution from the doctors and nurses.
So how many patients would you see in an annual year?
So last year we had 1,000 patients and we did 5,700 patient visits. So yeah, we're quite cost effective. What we're doing is we're keeping people out of emergency rooms. And that is preventive medicine, absolutely, and helping people manage chronic conditions. By the time people get to us, often they haven't seen a doctor in 10 years. And they walk in and they're like, I don't feel good. And it turns out they've got raging diabetes that's completely out of control.
You're
So
saving hospitals.
we are saving, yes. Can you go tell them that for us?
Comment and then a question. First of all, Amanda's being modest because she didn't say that she's a very long-time Rotarian, former president of the Teaneck Rotary Club. We've known each other for 15 years. You've known us 15 years. When I one of the first women presidents, I think. Huh?
Yeah, maybe. Actually, when I was president of Teaneck, I had just had my son. I remember Elaine would hold Drew on her lap because I'd bring him to board meetings. And he just turned 17 on Saturday, and he got his driver's license on Monday.
Yeah, there you go.
That's another reason I'm not looking so good this morning. Anyway,
Okay, but the question, the healthcare reform. These are people that can't get insurance even under that?
yes. So okay. So the comment every time I go out and speak, they're like, "Healthcare, everybody has insurance, don't they?" Well,
You're led to believe that, yeah.
well, I mean, Matt, the intention of healthcare reform is really good because honestly, everybody should have access to healthcare, and that's what it's trying to fix. I think to fix healthcare in the U.S., you basically have to blow the system up and start all over again. So, what healthcare reform has done is it has made healthcare accessible to more people. So New Jersey is one of the states that expanded Medicaid coverage. So Medicaid is like Medicare, but for low-income people. So it used to be that if you earned $12,000 a year or less, you got Medicaid. They expanded it to 138% of federal poverty level, which is that $15,000 figure that you threw out. So people who have been in the country legally for 5 years and earn less than 138% of federal poverty level, $15,000, are eligible for Medicaid, and we encourage them to apply for Medicaid because they get more. It's harder to find a doctor, but they get more. Their medications are covered. So, so if you haven't been in the country legally for 5 years, you can't get Medicaid. So we do have a number of undocumented patients. So that is a big pool of patients for us. The other people that we see, so if you earn more than 138% and I think less than 400% of federal poverty level, you can qualify for subsidies. So you think, okay, I'll go to healthcare.gov, I will get a policy. The reality is that between the cost of the premium and the out-of-pocket costs for healthcare, it's still unaffordable because the premium might be on the bronze plan, which is not a good plan, but it's the lowest level plan. You might be able to pay $14 a month for a premium, and you think, no big deal. Well, nothing kicks in until you've paid $2,350 out of pocket. So you go to the doctor, you have to hand over whatever the cost of a doctor's visit is. So for people who are literally living hand to mouth, they can't do it. So those are the people that we are taking care of. And those are the people, by the way, that are working back here washing dishes, who are the servers at your favorite restaurant, who do your nails in the nail salon, not all of you guys, but who are landscaping your yards. Those are the people, I mean, really, they're the people that we rely on to kind of take care of us, home health care aides. So it's really important, if they're not healthy or if they're sneezing in your food, it's not good for any of us. So, yeah, so that's who we're taking care of. Yes?
Do you turn anyone away? Can you only take so many?
So we actually have capacity, so I'm in full recruiting mode. I actually brought some little postcards that are English and Spanish, so if you know people that you think, if you have a favorite restaurant or nail salon, please feel free to hand them out, I'll give them to you. So we have capacity. Oh, no, we don't take everybody. So so we don't take walk-ins, first of all. In order to become a patient, we do a financial eligibility screening to make sure that they fall in those categories. We do a medical history because we're providing primary care. So if somebody walks in and says, oh, I need a new hip, they're not an appropriate patient for us. We have actually gotten 3 patients hip replacements, but not when they walked in the door. So as long as they qualify on all those things, then we will do blood work and set them up to see a physician. So yes, we can take more patients as long as they qualify.
Over there.
Yes.
I have 2 questions. The first one, this is
Can you hear the question? What was the question?
Oh, okay. So she wants to know about our staff and how they get paid.
Oh.
So out of that $940,000 budget, $600,000 of it is for salaries because we have to pay people. We have 16 people on staff. We have 3 full-time. I told you it's really early. I'm full-time. I've got an administrative director that's full-time who does everything, scheduling, IT, human resources, cleaning, whatever. And we have somebody at the front desk that's essentially full-time. Everybody else is part-time. We're a licensed ambulatory healthcare center, so we're licensed by the state. We have to jump through all kinds of hoops. We are closer to a hospital than a doctor's office in terms of the way we operate. So the state says, if you're gonna do that, you have to have a medical director. So we have a medical director, a part-time medical director. He's 81 years old. He was chief staff officer at Valley Hospital. He worked at Bergen Regional. He's a great guy. We have an associate medical director. We have a couple of nurse managers. We've got a nurse practitioner that allows us to do sick visits. And she does tons of triage on the phone, again, keeping people out of the emergency room. We've got the certified diabetes educator. We have the nurse navigator. We just hired an 8-hour-a-week social worker for our women's health initiative. We have a lot of anxiety and depression in our patients because they're worried about how they're going to put food on the table. Our front desk staff, we have 3 lab techs and a receptionist, basically, all of whom are bilingual Spanish, and they do the labs, they do eligibility screening, they do a bunch of other stuff. So everybody else is a volunteer. That's all we have on staff. Everybody else, we have 55 clinical volunteers.
Nice.
We have another 20 or 25 people who come in and do various things in the office. So we're really volunteer driven. We don't have a volunteer manager, which is weird since volunteer's in our name, but it's just not in the budget yet.
How about doctors?
How about doctors?
How many volunteers?
We have 20 volunteer doctors and 8 nurse practitioners. Most of our doctors are semi-retired or retired. We have volunteers. Most of our doctors are, say, 60 to 90 plus years old. And then our nurse practitioners and our nurses tend to still be working and volunteering on top of that.
Now, on the doctors, I understood that the doctor, if he wanted to volunteer, he can't, he's got to keep his license up.
He does,
and
yes.
that costs money, a significant amount of money. That means insurance.
It's okay. So insurance is the costly thing.
So in other words, a lot of doctors say, hey, I can't afford that stuff.
Well, I'm going to come back at you with that. First of all, they do have to maintain their licensure, which is not actually that expensive. If you let it lapse and you gotta go back and do it, it's a pain, but that's not a huge expense. Malpractice insurance is a huge expense. So what we have is we have coverage from the federal government. FTCA coverage says that if we don't charge patients and we don't pay our volunteers, that they will provide malpractice insurance for our volunteers and us as an entity, which is great. So that addresses that. And I'm sorry, you had 2 questions. What's your other one? Yeah. So you can go to bbmigala.org and you can donate away. We actually have a really cool auction too, bbmiauction.org. I'm going to pass out some stuff here. Or you can come to the events on Sunday, and that's how you get involved. It's going to be fun. It needs to be over though. Yeah.
What really blows my mind, it doesn't make sense to me to have to get a lawyer involved, but shouldn't there be a piece of paperwork? All these people are volunteering their time. You shouldn't need malpractice insurance.
Right.
They should sign waivers for their health care. They have no possibility of suing for anything.
Right.
That to me is insane, that they actually have the option to sue.
You're
Well,
forcing them to sign.
first of all,
I mean, that's just my thought.
Right,
That
no.
drives me crazy. Because there is
So
such a thing called the Good Samaritan thing, where if I see somebody drops in a restaurant, I can go try to save them,
exactly.
and I don't have to worry about being sued.
Quite honestly, people are not walking in thinking about suing us. They're thinking about getting health care
Well, that I'm
and
sure.
feeling better.
But sometimes
But
smarty one will be smart.
the reality is this is a horribly litigious society, and anybody with a brain in their head would not ever practice without having some kind of coverage.
Yeah.
So, and it's really it protects everybody.
One comment, if I might.
Give me a comment.
This has to do with the article that was in the record yesterday. About people worried about administrative costs and stuff like that.
Oh, for nonprofits? Yes.
For nonprofits.
Yes.
And saying that is a fallacy.
Yes.
Because if you don't have quality people manning the ship just
That
kind of
is
bangs
so
around.
very true.
So it's a very good article for everybody to read, so that you don't judge a nonprofit on what their administrative.
What their
costs are.
overhead is. Yeah, that's called the overhead myth. And for anybody in the nonprofit sector, it's something that kind of makes you want to beat your head against the wall. You would never, ever in a business think, I don't have to spend money on marketing, I don't have to pay my people well to get the best people. And that's what nonprofits have been told forever.
Right.
By people who donate to them, is that, oh no, you have to keep your administrative costs, your overhead costs really low. Well, that's stupid, because I want the best people working for me. I have to have good IT. We have electronic medical records, so we are managing data on 1,000 people. That can be, and we need to be able to extract it and manipulate it and figure out how well we're doing. So for us not to have good IT is silly. So thank you for bringing that up. And we do a good job, actually.
Good.
Yeah. Yes.
Sorry,
Sorry, I know.
Last question.
Amanda, what about medications?
Medications. So we do not have a pharmacy. When we were started, they made a conscious decision not to have a pharmacy because it's for a lot of reasons. So what our doctors are really, really sensitive to the fact that our patients don't have a lot of money. So when they can, they write prescriptions for generics, which you can get like a month's worth for $4 and 3 months worth for $10. Usually that works unless there's some strange medication they need. The other problem is insulin. Insulin is hugely expensive. And so most of the pharmaceutical companies have what they call patient assistance programs. You have to have a social security number in order to be able to sign up for those. So insulin, we do some workarounds. We often take money and purchase insulin to give to the patients. The really sad thing is if anybody's diabetic, they have pens now that are so much easier than the old-fashioned syringe and vial of insulin. but they're really expensive compared to the old-fashioned vials and syringes. So, so we have to go with the less expensive medication, but it might cause our patients not to be as compliant. So that's what we do with medication. All right, I'll shut up now. Sure, if you have any questions, I've got my card over here. If you want to get on our email list or our mailing list, give me your card or come write it down over here, and I would love to have you. If you want to come visit us. Thank you.
Amanda, what's the cost?